a question coming up from the organizers that in this difficult times of COVID pandemic, where as clinicians you need to actually spend a lot of time one-on-one with the patients. How is telemedicine affecting psychiatry? In the sense, how difficult it is discussing a patient's complaints and profiles via telemedicine rather than having him face-to-face discussing the clinical complaints. Are you finding the new normal a bit difficult to handle, or is it just going with the flow?
Well, the new normal is no more new. It's more than half a year now since we are in this so-called new normal. So there was a learning curve. So let's say in end of March and beginning of April, when there was a disruption, at least in India and in most parts of the world, when every physical OPD switched over to this virtual telemedicine OPD. So in the beginning, there was a lot of issues pertaining to technical connectivity. Sometimes, I mean, today we are having a good speed, we can see each other, but really in the physical OPD, we are having a look at the patient overall. Here you are just seeing maybe my face. I've had where the patients bring the phone so close, I'm just able to see the forehead, or I'm just seeing the ceiling. So in the beginning, I had to tell them that please adjust the camera so that I can at least see your face.
Because so the struggle started from there.
Yes, this was the real difficulty. And mind you, at least in India, my experience was most of our population are smartphone savvy, be it the young, be it the old. Everybody is on WhatsApp. So that has been a boon that the population did not have a learning curve using telemedicine. So people were aware of it. Of course, there could be connectivity issues in some parts of the country. So sometimes we may not get a proper picture or a proper voice. But the biggest deficiency was the in-person face-to-face. When we are looking at the patient, we are looking overall. How fast is he walking? What are the mannerisms? What is the body language, which we completely miss out.
Exactly. And that's precisely why I wanted to ask this question as to how are you finding the new normal?
Yeah, but having said that, the plus point was we are sitting unmasked, so we can really observe the facial expression. Whereas, assuming that it was a physical OPD, we would have been wearing a mask, so will the patient. So definitely we cannot see the facial expression. So that's another disadvantage of seeing in the physical OPD. And another good point for telemedicine, some of my patients who were coming from outside Mumbai, they could jolly well sit in their house, maybe even in Assam, and contact me. So that was the geographic distance was out. And this was another advantage, I would say. And the government of India actually did a very good step of promulgating the telemedicine guidelines in end of March, which really benefited that, we could previously, prior to that, telemedicine was kind of question mark legal or illegal. There was no clarity about that point. Now it has been formally legalized. Of course, it's not yet an act, it's just a gazetted notification. But the good point was we could write a prescription, upload a photograph for the patient, and this can be honored by the chemist. So there were a lot of things which worked during the pandemic. There was a learning curve. I would say at least the first 5 to 6 weeks, it was not very comfortable. If we get a new case, it was really not very comfortable, doing the consultation or working on the treatment. But I think over a period of time, we have adapted. Patients have also adapted. In fact, none of my patients have yet told me that they would like to see me in person in the physical OPD. Of course, there was a question, but beyond that, there was no insistence because there is a fear for the patient, there is an inconvenience for the patient, and these factors work. Having said that, I don't think that telemedicine is going to be permanent. At some point in time, there will be a hybrid model where we can have a face-to-face OPD and then followed by some consultations through telemedicine, and then again at a periodic interval, again face-to-face, specifically for the chronic medical condition. This may be the model for future, but it's too early to say if this is the case.
Then we will have to wait and watch the way this unfolds.
And see, one point, Ritesh, which I also was about to tell Neha also, is that be it a psychiatrist or a non-psychiatrist, one thing that we should not compromise is the time that we give to the patient.
Agreed.
So, you cannot have a consultation of 5 minutes or 10 minutes. Definitely not in psychiatry. or even 15 minutes. If it's a new case, I'm going to be spending at least 45 minutes to maybe an hour. The idea, and this is what differentiates psychiatry from all other specialties, we are looking at who is this person that is having this illness, rather than what is the just the illness that this person is having. So we are looking overall. So we are taking into account what is this guy or girl, what is their personality, what is the environment, and then what is their problem. So we kind of integrate that. Whereas another medical specialty, they are just bothered, okay, is the heart working well or not? We are not bothered about anything else. This is what differentiates. And to do this, we need time. And listening is therapeutic. So it's not just what we tell, it's also giving a patient active listening, making the person
Very much.
feel that there is somebody who's trying to make sense of what is happening to them. That itself is therapeutic. So, suddenly the clinician may have a patient telling him, Doctor, you heard me and I'm feeling fine. And the doctor is wondering, how can that be? No, it is possible.
That's true.
Patient active listening. So sometimes we know that we cannot do much for the individual, but just give our time and attention. That itself is therapeutic. So in
Yeah.
a pandemic, telemedicine may be sometimes a little bit taxing because you cannot have a lot, patients assume that because you are on the phone, they can have a lot of your time. So some boundary settings will have to be there.
Yeah. And listening is a skill also.
Well, it's a
All of
skill.
us as doctors have to develop that talent to be good listeners.
Yes,
Because
but
all of us are good in giving advice, but we need to be good listeners also.
for that we need to be non-judgmental. If we have preconceived notions that, okay, I know this, at least at a family doctor level, I know this
Yes.
family, they're always like this only, always cribbing. We should not have those preconceived notion or a set bias as we call. Give them the opportunity. Of course, then we need to have a boundary setting. So what is accepted, what is not accepted needs to be gently told. And this comes over a period of time. And actually, one point which Dr. Neha said, which stands out from all other internists, she did a specific internship in psychiatry. And this is something I will strongly advocate. You see, at a graduate level, that is MBBS, at least in India, I think the internship in psychiatry is what, 15 days?
Yeah. 15 days. I'm talking
15
about
days.
1999. So 15 days.
Yes.
Yeah, it
Because
was.
when I did my internship, it was in '96. It was
Yeah.
only 15 days. The
15
only
days. I agree.
only
And
thing
third
I
MBBS psychiatry paper was about 15 short notes in psychiatry. So all you have to do was read up about 50 short notes, out of which 15 short notes came in your papers.
No, absolutely. I think I agree with what Dr. Ashutosh said. There was definitely a learning curve, but now that is kind of the norm. And not to pitch psychiatry versus internal medicine, but I think psych over telemedicine is easier. I will say that as opposed to internal medicine consults, because physical exam is really important in our specialty to be able to actually see and in person and touch and hear and listen to the lungs and all that. So it's definitely more tricky, but and it's somewhat limiting in that sense, but the technology has taken off so much with patient monitoring systems now that patients can actually wear, and their actual heart sounds are transmitted to your computer. Their vitals are transmitted, so you are actually able to see and hear all that live as you're looking at the patient. So it's been amazing, and the access is very important. I think a lot more people have access to medicine, especially psychiatrists and mental health specialists. It's enormous. We have several telemedicine platforms that provide even psychotherapy via telemedicine. So not just psychiatry, but therapy sessions online. And these are they are very popular because, as you said, it's safe. You can sit without your mask. You can sit in the comfort of your home and actually talk to someone. And a lot of times it's about having that person hear you, having somebody listen to you. So it's extremely valuable. It's reimbursed by insurance companies. Telemedicine, in fact, the visits are now reimbursed at the same rate as if they were in person. So we have, but that was a big change in the reforms that promoted telemedicine. Because let's face it, if you're not going to be paid for your hours worth of time, it's difficult to keep doing that every day. So I think a lot of grassroots level law changes in reimbursements were made to facilitate telemedicine as a platform, and having access in these difficult times to health providers and mental health specialists is so important.